I am Vaishnavi Chiddarwar, a third year PhD student from Texas Tech University Health Sciences Center, Lubbock. I'm going to be presenting my poster entitled The Relationship Between Sociocultural Factors and Gender Specific Movement Patterns During Low and High Intensity Movement Tasks in Cis-gender Women. Women are at a 6 to 8 times higher risk of anterior cruciate ligament injury or ACL injury compared to men. ACL injuries are associated with high financial as well as emotional burden. Re injury rates after an initial injury are as high as 60% within the first year. Sex and gender have been used interchangeably in ACL injury research. While sex is determined at birth based on one's reproductive organs, gender is the social and psychological identity of an individual. Sex specific factors include morphological differences, neuromuscular differences, hormonal differences between the sexes, while gender differences or gender specific differences may include subtle non anatomical factors such as sociocultural factors. Sex specific factors do not fully explain the injury risk discrepancy between men and women. Therefore, there is a need to explore the association between sociocultural factors and hip or knee movement control during different types of tasks. Popular culture, books, news, and advertisements have introduced gender based stereotypes through subliminal messaging. The sociocultural nurturing thus may have an association with movement. Therefore, the objectives of the current study were to explore the relationship between sociocultural factors, specifically gender role socialization and trait self objectification, with hip and knee sensory motor control during different high and low intensity tasks. Secondly, this study aimed to explore the relationship between hip and knee kinematics during low intensity tasks with the same corresponding values during high intensity tasks. We included 18 active cisgender women between the ages 18 to 35 years with no past medical history within the last 6 months. Cisgender individuals are individuals whose sex and gender identities align with each other. After a brief warm up, individual performed 3 repetitions of 6 different tasks. The low intensity task included the stand to sit transition, the single leg stand to sit transition using the dominant leg, and the single leg stand to sit transition using the non dominant leg. The high intensity tasks included a drop vertical jump, followed by a single leg drop vertical jump using their dominant side, and a single leg drop vertical jump using their non dominant side. The task order was randomized, and the dominance was determined using the leg that they would prefer to kick a ball. Our outcomes included triplanar 3D hip and knee kinematics that was captured using a 3D motion analysis system. The sociocultural measures were objectified using a trait self objectification score and gender role socialization scale scores. In terms of statistics, we performed an a priori power analysis after which 15 subjects were considered sufficient for the sample. We checked for assumptions, normality assumptions. If the data met the normality assumptions, we performed a parametric Pearson correlation. And for the non parametric data, we used the non parametric Spearman correlation. We found that the non dominant hip kinematics in frontal plane during the single leg stand to sit transition using the non dominant side had a moderate positive correlation with the trait self objectification score, and it was statistically significant. This result was in our predicted direction. Secondly, we found that the dominant hip kinematics in frontal plane during drop vertical jump had a negative moderate correlation with trait self objectification score. Though this was statistically significant, it was not in the direction we predicted. We also found that the non dominant knee kinematics in transverse plane during the stand to sit transition was negatively correlated with trait self objectification score. Yet again, this result was not in the direction we predicted. As for the second objective, we found some strong positive correlations between dominant hip kinematics in the frontal plane and non dominant knee kinematics in the frontal plane during drop vertical jump and stand to sit. These correlations were strong positive and statistically significant. The strong correlations between the two types of task, the high and low intensity task, indicate some sort of similarities or overlap between these tasks. Thus, low intensity tasks can be used as a valuable source of information for early detection of injurious movement patterns in women who are more prone to non contact ACL injuries. The injurious pattern most common for a non contact ACL injury is the position of no return that includes hip adduction, internal rotation, and knee valgus. Low intensity tasks have been previously used to assess patellofemoral pain risk in females. Thus, the findings from our study corroborate with previous research. The moderate correlations that we found in our current study were not in the direction we predicted. The likely reason for it could be that trait self objectification scale has been previously validated in women with eating disorders and body dysmorphia. The current cohort included active women with no history of any injury. Therefore, the scale may not have been sensitive enough to gauge the degree of self objectification in the included population. Gender roles did not show any significant correlation with the hip or knee sensory motor control during high and low intensity task. The reason could be that the included age group was between 18 to 35 years, relatively young women, and since gender roles have evolved over time due to increased participation of women in workforce, education, as well as athletics, the current cohort may not have conformed to dated gender roles. In conclusion, we can say that hip and knee kinematics during high intensity tasks are strongly correlated with same corresponding values during low intensity tasks. Therefore, low intensity tasks can be used for early detection of injurious movement patterns without undue stress on the lower quarter. Trait self objectification has a moderate correlation with hip and knee kinematics during low and high intensity tasks, and further exploration of other sociocultural factors with knee and hip sensory motor control during other types of tasks is warranted. Gender roles did not have any significant relationship with hip or knee kinematics during both low and high intensity tasks. Therefore, there is a need to further explore other non anatomical factors that may best be able to explain the high injury risk discrepancy between men and women. Thank you.